I'll start off by just kind of talking a little bit about the topic. So this is couples and MS, and we're going to cover today signs that, you know, if your partner and yourself may want to consider couples counseling. And so we will go ahead and we will move to our next slide. So this program is brought to you through MS Views and News, which I know that you guys know that, but it is also brought to you through our sponsor. So thank you to Bristol-Myers Squibb for their incredible sponsorship that allows us to support, that allows this program to be here with you this evening. So we're going to talk about a couple of things, but before we get started, I wanted to introduce myself. So my name is Jessica Thomas, and I am a licensed clinical social worker. And I have been working with people specifically living with neurological disease and multiple sclerosis for, I would say, probably about 16 years. And I've been living with MS for 17 years. So if you don't know me, you know now that I am a therapist, but I also live with MS as well. So we're going to go to the next slide, and this is another chat box question. Have you ever participated in couples counseling before? And if so, what did you learn about yourself and the relationship? And so I will get us started with that. When I was first diagnosed with MS, I brought my husband to a couples counseling session. And the reason why is because I was really nervous about having MS, and I felt really bad for him. So, so the idea of us going to the couples counseling session was really just to help check in on him and how he was doing. We have Patty here that she did go to couples counseling, and she learned better ways to communicate. Thank you for sharing that. And then we have Takara that said yes, but he didn't open up. And sometimes that can happen where one person wants the counseling a little bit more than the other person does, and that can change the dynamic. And then Maria went to couples counseling before she was diagnosed. It made her brave and set the tone for the future. I always love your spirit, Maria. And then Maddie said, no, I have not, but I haven't had a good relationship since I was diagnosed. So maybe today you're going to learn some things, Maddie, that you can apply to relationships in the future, or you know, or possibly if you have a romantic relationship in the future and you identify some of these red flags or some of these opportunities, even you may consider it. And Patty also said that she needed learned that she needed to be referred to a psychologist and needed some medication to help. Thank you for sharing that. That is very helpful for people to know. So we're going to move on to our next slide. And this is a slide, if you've been on some of my programs before, this is going to be familiar a little bit, because I say it often. You know, relationships matter, and MS impacts everyone in the relationship. And in relationships, I've said this before, and I'll say it again because I do believe it. Relationships can either be strained or strengthened in the face of MS. And that MS doesn't ruin relationships. Only people do. And while there is not a lot that can be done for some of the damage that MS causes, relationships actually can be improved, and of course it takes both people for that to be the case. So we'll move on to our next slide. We're going to talk a little bit about signs that you need, that you may need couple counseling. So this is not all inclusive. There may be another sign that I don't talk about, but I have a couple of signs here, and I think that these are some pretty good general signs that you may want to consider couples counseling. And so, I'm not going to say this person's name, but someone did mention in the question box that her partner wasn't willing to do couples counseling, but she's doing it herself now, and that's incredible. And I am very, very happy to know that. So signs that you may need couples counseling. So one of the first ones I wanted to start with, and I'll hold it this way, is fighting often. If you and your partner can't seem to have a conversation, a discussion without getting into an argument, it may be time to learn how to communicate a little bit more effectively. It is common to have disagreements, and it's common maybe that couples fight sometimes. But therapy can teach you how to diffuse arguments, how to speak to each other more calmly, and ensure that you guys are treating each other with respect. So another sign, bickering constantly. So so this is not the same as fighting, but bickering, if this is something that you and your partner do, or you may have seen other couples do this, that this can kind of tend to wear down the goodwill that exists between a couple. And it can make a lot of the everyday interactions feel a little bit more irritating. It can be kind of exhausting, actually. Because often when we're bickering or going back and forth about something, we don't know how to communicate about something we're either trying to ignore, something that we're irritated about. And sometimes we don't even realize how bad or how frequently we are bickering. We're just sort of doing it. So if you find that you're bickering a lot, that might be a sign. Now, here is another possible potential sign. Speaking different languages. Okay, so I'll clarify this a little bit more. So what this means is not literally different languages. I mean, it could be a part of it, but not really. So so sometimes it might seem like you and your partner are not talking about the same things, that you're what you're saying, what your thoughts, your ideas, that you are, if you're sharing an idea, that they don't hear what you're saying and they interpret it differently. And this can be often from different communication styles. And so a therapist would really be able to help teach and help you to adapt to work better together. Okay, this is another sign. Everything is fine. So if you find yourself saying everything is fine and you're ignoring important issues or trying just to pretend that everything is okay, you might want to consider therapy instead. And the reason why is that keeping this to all to yourself, it works for a while. You know, keeping it inside, you know, being quiet about it, it might work for a little bit, but it's never really an effective long-term strategy just to cover up issues with everything is fine. And a therapist can help you figure out how to tackle some of those issues. So another sign is the same issue cycle. So this is mostly about important issues. It might be like related to having children or related to MS, etc. But if you find yourself getting into a pattern where you have a discussion and you're not able to have any resolution and you just kind of deal with the same thing all the time, the same kind of conflict or discussions, etc., and you can't ever close the cycle, you can't ever find a way to connect, then this might be helpful to consider therapy, because therapy can get to the root issue, and a therapist can help you to kind of like stop going in circles and address kind of the real issues and be a good neutral third party to that. Now, I'm going to get into some MS specific signs. That there's signs for everyone, but I'm going to relate this to MS a little bit more too. So another sign might be you're about to make a big life change, or you've had a big change, a big life change, a transition, etc. So in this area, I think, if you've been diagnosed with, with an illness, when I was diagnosed with MS, for me, that was a big life change, and I was a newlywed. And so that's why I wanted my husband and I to go to therapy. But then also I see, we have a teenager, and, eventually I know he'll go to college, we hope. And then we'll be empty nesters, and that will be a really big transition. And so I could imagine that that's probably a big change that would welcome counseling. Sometimes it can be, it doesn't have to be a bad change either. It can actually just be a transition or change. But if you're fixing to make a life change, or you have had changes, this is something to consider, because a therapist would be very helpful for you in that situation, for you guys as a couple, and to figure out how you can take that on together as a team, and work towards shared goals. Now, here is another one that I'm going to relate to MS. Intimacy and sex. This is another one of the main reasons that people seek therapy. So sex changes, lack of intimacy is one of the main reasons that people seek couples counseling. And you may find that you and your partner have mismatched sex drives. That does happen as people age. But also with MS, there can be some changes that affect your ability to have sex. And so if you notice, and I hear this a lot with patients that I work with, that they struggle with either a lower libido because of depression, or they have some physiological problems because of their MS, and it makes it hard for them to enjoy sex with their partner. And so if you experience challenges in your relationship that are because of sex or lack of intimacy, a therapist would be a great place to start. There are sex therapists that work with couples, and they can help with sexual issues, but also general therapists, psychologists, licensed clinical social workers can also address issues around intimacy and sex. And so something to consider, because I know that this is a real issue often with people with MS. So the next one is money. I bet that you, if I would have asked you some of the reasons, you would have put money there. And so sometimes couples have different spending habits. And sometimes there might be a partner that has anxiety about having enough money. When I think about MS, sometimes what I think is that when I think about MS, that sometimes there are people that live on fixed incomes, that they have to leave the workforce, and this can cause a lot of stress and tension. And so a counselor and couples therapy might help you to understand your relationship with money and help you guys compromise on your finances, especially if you guys are not on the same place of how you spend money. Then the next thing is not on the same page. This means that if you or your partner want different things out of your relationship, this might be a good time to see a couples therapist. Partners are not always on the same page about what they want. And sometimes we think we know what we want when we're first together, but as we get older, we mature and change, that we may change what we want. So this can be an important time to welcome a therapist or a couples counseling into your world. So that way you can find a way to for you and your partner, if the goal is to stay together, to both have the things that you want to do and be able to live together. So the next one is an affair or infidelity. Now, there's a lot of reasons why this may happen, but any time that there's been an affair or infidelity, it is a sign of a broken relationship, and also a break in boundaries in the relationship. And so it's best if that has happened in your relationship that you seek couples counseling. It is very hard to mend those kind of breaks in trust on your own, just the two of you. So then the other one, I'm almost done with this list. That's why I did it this way, to make it a little bit more interesting. Your partner wants counseling. Partners and people are not always on the same page about what they want. And that can be very much the truth when it comes to counseling. You may have one partner that wants it, and I think actually we had someone earlier that shared that, and one partner that didn't want it. If your partner is interested in therapy, you know, the recommendation is to give it a try. And so I'm going to end with another sign that that you may need couples counseling or may want to seek it, is a healthy relationship. You can have a healthy relationship and go to couples counseling. Therapy is not a bad thing. We, you know, we see personal trainers to get into shape. We work with, you know, life coaches if we want to figure out, you know, changes. So there's always something for us to learn, and there's always a way to improve. And so going to therapy is a sign that you value your relationship and your partner. And it doesn't always have to be that something bad is going on. So those are some signs that you may need or may want to seek couples counseling. Let's stop there for a second, and we're going to go to the, we can go to the next slide. And we're going to go to the question box. Did any of these signs resonate with you? For example, I shared the life change when I was diagnosed with MS that actually brought my husband and I to therapy. Now, I'm going to be very careful about what I'm reading here. If there's something that's very private, I will not say your name. And so we have, Maria said, the list for sure. And then let's see. Oh, I think that's all we have so far. So, and then we had someone that said the bickering. So the bickering is something they can resonate with. I think over time, sometimes bickering can be common, and finding a way to reduce that a little bit, because it does wear you down. So we're going to move on to our next slide. And so if you can think of any of those signs, and if they resonate with you, it doesn't mean that it's a telltale sign that you need therapy. It's just something to consider, that it might be a sign, and it might be a time to talk with your partner about. We have someone that said several of the items resonated with her. One was MS and the loss of her identity due to her job loss. That's a big change. Another was fighting a lot, and then another person said bickering. Bickering for sure. So we're going to move on to couples counseling specifically for MS. Why should you consider it? So I'm going to go through some reasons why. So exploring the past contributors or strains in your relationship may, to know this, they may actually increase when MS, in the face of MS, if that makes sense. So you might have had differences earlier on in your relationship history that may have exacerbated as a consequence because of having a chronic illness or MS. And this furthermore can, you know, create distress, low mood, anxiety, anger. So this may be one reason to consider couples counseling for, you know, specifically for MS, is to kind of look at past contributors, so that way you can find ways to work with them. The next one is that counseling is a safe place where your relationship can be understood under the context of MS. And a therapist that's working with couples will work both with you and your partner, and they will help for both of you to adjust and accept to the changes to live a meaningful life together. And so in this context, it's not just the therapist talking about the relationship, but it's the relationship and then also within the context of MS. And that's important because MS does impact relationships to a great degree sometimes. So what will be involved in these sessions? And I'm going to go to the question box real quick. I'm not going to ask a question, but we've had I have someone that said, oh yes, MS changes a marriage. And thank you, Rhonda said I didn't mention lack of communicating. That is so true. I think it's kind of embedded in a little bit of that, but I didn't just say it, lack of communicating. And that is such an important thing. And I think the lack of communicating is a big sign. Absolutely. So what is involved in these sessions? So in counseling, if you're seeing a counselor, a couples counselor, you're going to be carefully thinking about the changes that you guys are both experiencing. And you're going to work on understanding the impact of living with chronic illness or MS on intimacy. Developing communication. And I think most importantly, establishing how you both would like your relationship to be. And how do you move forward together? And when I say move forward, moving forward with also knowing that there's a lot of ups and downs and hills and peaks and valleys with MS. So understand, another thing that would happen is that with couples counseling, specifically with MS, is understanding the impact of the condition on both partners. So in this, the counselor is going to help you to identify and make sense of the, some of the cognitive, the emotional, the physical changes that may occur with chronic disease or MS. And counseling should help foster you foster as a couple a way to communicate, how to find understanding. We know MS, a lot of MS, some of it's very visible and some of it's very invisible. And so couples counseling should help to address that. Couples counseling will also provide a safe space to share feelings and maintaining closeness at times during distress, and especially during times of uncertainty. And then the couples counseling for MS should help to cope with some of the uncertainty. I'm going to look at the question box real quick, so we've had a little bit more movement on there. So we have someone that said that definitely they've experienced changes in intimacy, sexual changes have occurred, and often not being able to move as independently. And then we have someone else. And one person shared, they're not able to have an orgasm, and that's an important thing. And so couples counseling can help, kind of uncover some of these issues and talk about them, because if not spoken about or not uncovered, it can create a lot of tension in the relationship. And then we have someone that shared that they had a health crisis a couple years ago, and thankfully her husband is a therapist, and he was able to help use his skills and help to work through the crisis. But they were very careful about sharing their problems and feelings that they both were experiencing. So we're going to move on to the next slide. So couples counseling specific to MS is one of the things is to help you strengthen your relationship's capacity, to help you get through difficult times and challenges that that MS may present. I've been married for, this year will be 18 years. And when I think about, personally, I think about the span of years that I've been married, and I've had MS for 17 of those years, that there's been a lot of peaks and valleys. And so the point of counseling would be to help strengthen your capacity to work together through those, through those difficult times. Also, it's aimed to strengthen your relationship resilience. Now, I talk a lot about resilience because I'm very passionate about it. And resilience is what allows you to work through challenges together. So counseling would allow you to have a safe space to learn to develop some coping skills to help you build a relationship resilience. So that way, when challenging times happen, that you are taking it on more as a partnership than an individual. And then finding areas of growth and potential for both people in the relationship. Now, when people are in counseling, couples counseling, it's two people, and so and I think it's important that they are uncovering and talking about how MS has impacted both partners, how both partners work together, but also looking at potential growth and opportunities. So this could be seen as a period of change that you can creatively work together. This might entail figuring out how you carry out tasks. This may also discuss how can you communicate better. And you also may find that in this part of couples counseling that there might be a lot of, not a lot, homework. And homework is great because homework is for you to sharpen skills, to gain more insight, and to grow. And so I think any therapist that gives you homework is doing a good job with doing that, because they want you to work. Counseling is not just about the time that you're in the session, it's about the time afterwards too, and how you reflect and utilize those skills. So then also, counseling for MS is going to talk, if you were interested in counseling as a couple, communication basics. And building a foundation for good communication. One thing I think that's great about couples counseling is that this gives you a safe space, a neutral place that you and your partner can talk about all sorts of different feelings, such as guilt, anger, resentment, fear, love. And because it's facilitated through a therapist, it should be a safe space with each of the members of the couple. Each person feels heard and is able to really hear the other person. When feelings can be both spoken and received, they become a fabric of the relationship, and that's where growth can happen. And so in what I would expect in couples counseling for MS is that communication basics are explored and uncovered. Now, another great thing that happens with couples counseling when the focus is on a chronic disease is that there's a focus on how to adapt. Happy couples are those that can adapt. Even couples without added challenges of chronic disease have to really find ways to adapt to things in life. Children, job changes, job losses, relocation, aging. There's a lot, caregiving of aging parents. There's a lot of things that we have to adapt to, even if there wasn't chronic disease involved. And life is filled with change. So couples that learn to accept and navigate change are really well positioned to deepen their bond. Now, I'm all about silver linings, and I will say this is just one small silver lining, but a silver lining is that chronic disease is an automatic awareness that there's going to be change and there's a little bit of unpredictability. And so, so from the beginning, you know that you might have to learn to adapt. And I'm going to say that was a silver lining for my husband and I, is that that we've kind of taken on our marriage, kind of knowing we have to adapt along the way. And so we tend to deal with challenges a little bit easier than maybe some of our peers that don't have a chronic illness present in their relationship. So the other thing that that is really important is acknowledging grief together. When chronic illness or MS is involved in a couple, there is grief for the person with the diagnosis and the partner that would support him or her. There is a pre-illness self and a post-illness self. Now, the disease may not fully change you in that sense, but I'll give my own example. I feel like it's a fair example. When I was first diagnosed, I had a lot of grief, and I was really worried about my husband's reaction. And we went to couples counseling, and that was very helpful. But when I think about the pre-illness self, there's a part of me that I always remember that was me before my diagnosis and then me after my diagnosis. And there wasn't a lot of change other than I started a new treatment. But I did have more anxiety. I did have this idea that I knew that that life could be a little bit more challenging, and it definitely would have a different trajectory than what I was thinking at my young age. And so acknowledging the grief together as a couple is really important, because both of you carry some grief. And some of this grief and some of these changes can be real, but they can also be perceived anticipatory grief, which is a lot of what I experienced. I worried about the future. I worried about what I would not have, if that makes sense. So I'm going to look at the question box real quick. Okay, we have someone on here that's been married for 35 years, and he did not speak English and she did not speak Spanish. So they've learned so much together despite everything, and couples counseling was still beneficial. That is so beautiful. Thank you for sharing that. You literally spoke different languages. I love it. So another thing, another aspect is solving problems together. So couples counseling for MS or for chronic illness is going to look at focusing, how do you solve problems together? So counseling will open the ability to negotiate, and a counselor can help you to kind of prioritize things in your relationship, recognizing where your priorities are, and then recognition of kind of shared problems that both of you have. I know that this is, an area that when I work with couples, that often one of the things that we do is that we understand that MS has a lot of limitations, or can have limitations. I know for myself, fatigue is a huge limitation. And so my husband and I have to figure out how to work together with parenting and parenting responsibilities, etc. And so when you're in couples counseling for MS, the idea that you will kind of focus on how do you solve problems together as a couple, because you are both a unit. So we'll move on to our next slide. I'm going to read something from the question box. We had someone who said that they've grieved over who they used to be. And she's had a hard time not being able to do what she hasn't been able to do. I'm sorry, I've got to move this. I can see it. She's had MS for a long time, and married for over 40 years, and has had MS for over 20. And her grandkids never have seen her as athletic or as active as she was when their parents were young. And that's grief. That's a grief and loss right there. And then we have someone that said they've shared problems and prioritized their problems. However, they've learned, she's learned her husband's strengths and her strengths, and we use those strengths to address the problems. That is exactly what you want to do. And so if that is something that you can't naturally do with your partner, couples counseling will totally help facilitate that as well. So another thing would be appreciating a new normal. So with change, change brings loss, but it also brings an opportunity for growth. Couples that see chronic illness or MS as a shared challenge, as a partnership, tend to find ways to connect. And while they might be different than our old ways, they can also be as satisfying. One of the things I think of when I think of MS, I think of a silver lining is the appreciating the focus of like a slower pace. Or another thing that I tend to think of is that not only a slower pace, but being really intentional about honing in my focus instead of trying to multitask and do a lot of things, that I really pay attention to what matters most and I hone into my focus, and I enjoy things at a little bit slower pace than some of my peers. And that's allowed me to enjoy some aspects of my relationship a little bit differently as well. I do not have a perfect marriage, and I want you to know this. I'm just sharing some of my personal examples as well. And then, so our next slide is going to talk about something I've mentioned already, but happy couples can go to therapy. You know, and I want to reiterate this, that you don't have to have problems, or you don't have to wait for problems to come up. People that are satisfied in their relationship still seek out therapy. One of the recommendations is to have goals that you would like to work on. I know that probably my next phase of my life will be when my son, you know, graduates from high school, and I'm pretty sure I'll drag my husband to therapy, and we will talk about life now that we're empty nesters and what that looks like. So just know that that happy couples can go to therapy, and there is nothing wrong with that, not one bit. And therapy should help you build a strong foundation. You can learn to prevent bad communication patterns, patterns that we fall into, that we can slip into very easily. And learning good relationship skills early on is really the best way to avoid this kind of negative emotional buildup, like the bickering, the fighting, that can often be toxic. So for like Maddie, who had signed on earlier, and he said he's not in a relationship, you know, this is one of the benefits of doing counseling earlier on, is building a strong foundation. Because at the end of the day, relationships matter. And how we foster our relationships matter very much so. And when MS is involved, it's an extra layer. And we need to make sure that we are setting a good foundation for our marriage, or for our relationship, for our partnership, etc. So, so additional benefits of couples counseling. It gives you some, this is some perspective, and I love this. I saw this and I thought, I've got to include this. It's cheaper than a really fancy date, and it's way less expensive than a divorce, right? Therapy will cost you way less and bring you closer together. Couples therapy is great for divorce prevention, but it's also really great for just improving your relationship. And it can bring a couple closer together. And couples therapy provides a safe place for you to work on grievances, to work on challenges together. So I'm going to pause here for a second and see if we, I don't think we have anything from the question box yet, but I'm going to share some resources next. So resources to consider, other resources to consider. So the MS Views and News Learning channel, this is on YouTube. If you go there and you type in relationships, you can see there's YouTube videos on sexual dysfunction. There are programs on relationships, communication, caregiving, all sorts of really good presentations, programs, kind of like this evening's program, except this is a little bit different because we chat a little bit in this type of program. And then also the National MS Society has a program that I've helped with before. It's called Relationships Matters, and that's probably why that verbiage stays with me, although I think it's pretty meaningful and it's true. And so you can go to the National MS Society and get more information about the Relationship Matters program. But it is there is a booklet that you can download, and there's a lot of really good resources there. But it is a program that works with both partners, and both partners would want to, need to want to participate. Also, I found that doing some research looking at all the other MS advocacy organizations, like MS Association of America, MS Foundation, Can Do MS, National MS Society, etc. They all have really good relationship articles and things to read. And so I just wanted you to know. Elizabeth asked if I can email these resources to you. I don't have access to email them, but you know what? What I would recommend is, if you have your cell phone right now, take a picture of it. And if you don't have your cell phone, know that this is going to get uploaded on the MS Views and News YouTube page. But I will ask Stuart, or I will ask someone if we can get them to you. I just personally, I can't email them to you, or I would. But taking a picture with your phone is one of the best things you can do as well. And then other resources to consider, and this is something that I heard earlier on in our chat box, is individual counseling. So sometimes someone might want to consider counseling with their partner, and maybe their partner is not ready or is not interested. I recommend in those cases to seek individual counseling. This way you can develop your own sense of self, and that you have a place to process your emotions. Relationships take two people, and so if your partner's not willing to go to couples counseling, or just not interested yet, I highly recommend that you seek individual counseling. Now, one of the things I wanted to mention too, because this can come up, is often people will ask, well, how do I find an MS specialist in terms of a counselor? And so my recommendation is this, that both MSAA and the National MS Society, I believe, have provider listings that you might be able to find a healthcare provider that specializes in MS like I do. But another resource is that you can look at a couples therapist that has chronic illness experience. And so it doesn't necessarily have to be multiple sclerosis. There's a lot of I work with a lot of other chronic diseases. I specialize in MS, but I worked with other chronic diseases because a lot of the themes can be transferable. And so if you can't find a specialist in your area, if you work or if you live in more of a rural area, a good couples counselor that has experience helping people navigate through a life change like an illness will probably be a really good fit. And I just wanted to make sure I addressed that, because often people want to know, well, how can I find someone that specializes in MS? And so the next resource I'm going to share is the 5 love languages. And we'll move to the next slide. So I'm not going to talk about this too much, but there's a website at the bottom, and it's 5lovelanguages.com. If you Googled love language quiz, it would take you to that 5lovelanguages.com. But I find that this is a really important thing to do, to know about yourself as an individual. Also, for you to know about your partner. We talked about talking in different languages, and we had someone that literally they talked in different languages. But sometimes our love languages are very different, and we give and feel loved very differently than our partners often. So it might feel like we are speaking different languages in that sense. Now, today's not a full couples program, and I'm more highlighting considering counseling and such, or I would go in depth on this. But it's important to know what your love language is. There's 5 love languages, and we usually have a blend of all of them. But there might be one primary and a secondary. And if you know your primary or secondary, you will understand a little bit more about yourself, as well if you know your partners, to know about theirs too. We have someone that said they're very lucky because they don't know as an individual if they would have become as open because her husband loves her much more than she deserves. I think we all deserve to be loved, and I'm so glad that you have that relationship. And if you don't have a relationship and you're I want you to think about the people in your community, your friends, etc. But we all deserve to have love and have reciprocity in our relationships and have good, healthy relationships. And even in the face of MS. So now I want you to go back to your chat box or the question, if you can. What is something that you're going to take away from today's program? I'm going to, and I'll start us off. I'm going to take away that one, that we've had really good participation. I've really enjoyed reading your comments, and I especially loved learning about literally the English and the Spanish, and the learning to how like when one doesn't speak the other's language literally, how much teamwork that would have taken. And I think too, learning how grief is very universal for many of us. So let me know what is the takeaway that something that you would like to consider. It's today's program is not about convincing you to go to couples counseling. It's just kind of knowing how the resources, and so we have one is that takeaway is that marriages could be helpful with a neutral party involved. Absolutely, that is a really good takeaway. And here I want to also open it up. Are there any resources that you would like to share that have been helpful for you and your partner? So maybe it's instituting a date night, or another resource, one that I heard is getting a referral to a psychotherapist or a psychiatrist for medication management. That's a really great resource to share. Is there anything that oh, I love this. Couples counseling doesn't mean you're failing. It means you're expecting the challenge to become better. So you're accepting the challenge and you're doing this to become better together. That's perfect. Someone said that their takeaway is communicating with their partner the importance of us going to couples counseling. I think and remembering that couples counseling doesn't mean that anything has to be wrong. Things can be right. And then Rhonda says, great information for building strong relationships. And I think couples counseling is very much that. I was hoping when I was preparing for this program today, I was going to be able to go to the library, but it was closed because of Easter weekend. But your library also has a lot of really good resources and books on, I have no doubt your library does, mine does, and I don't live in a fancy area. A lot of really good books on communication and relationships. And so I want you to know that often you might have resources at your fingertips that you don't know about or you haven't accessed in a long time. So Wanda said, it's nice to know I'm not alone. Communication is a big one for us. And so she's learned counseling has helped them communicate better. That is awesome. And so this, program, was, more targeted towards couples, but I've been listening to you guys and listening to some of the things that you want to learn about. And so stress management and stress and MS has been coming up a lot. So, so the next MS mental wellness chat is going to be in May, and it's going to be on stress and MS. We're going to talk about how stress is inevitable, but choosing self-care through stress management, and how we're going to specifically do tools. And I'm even going to have a couple of things that we can practice while we're on the webinar together. And so I'm going to read a couple more comments. So someone said counseling can make it evident that a divorce is imminent. Sorry, but counseling did this for me in my first marriage over 40 years ago. And you know what, Maria, one of the things that I didn't mention that I should have is that sometimes counseling can be really helpful to decide, is is our marriage sustainable or is it not sustainable? Or how do we, sometimes I recommend patients to go to couples counseling to kind of figure out how to separate. And that is okay. And that's not failure either. That's finding out how to end a relationship. We have someone that lives in a very rural area, and many libraries have the app called Libby. I love Libby. And it's a way to check out library books on the internet and receive them electronically. If you do not know about Libby, please look into it. That is a really good resource. I love it. And then the person that got divorced after going to couples counseling said it was right for her, and it pushed her in the right direction. And so you could see that there's a benefit from even that experience. So I hope that, don't go away quite yet, but I hope that in May that you guys are willing to join me for the Stress and MS, and we'll really be honing in on how to manage stress, because stress is happening all the time around us. And so the next slide, we're going to talk about, so what happens from here. So I want to thank all of our sponsors for tonight's program in support of the MS Mental Wellness chat series. This is an incredible program. It brings people together. It's crazy. I talk for an hour and it brings people together, but it's because you guys participate and you use the question box and you connect, you bring your resources, you bring your experiences, and I just get to share them. So immediately following tonight's program, there will be a survey that will directly connect you to a survey. Please stay on and complete it. MS Views and News wants to hear your feedback, but I also look for it for topic ideas. So if you have some topic ideas, I'd love to learn it there. So we'll move on to our very last slide. And so if you know me well enough, this is a map in North Carolina, and I'm around the area on this map. But I don't like to say goodbye. Often my counseling sessions, I'll say, we'll put a bookmark here, because that means that we'll pause and we'll pick up next time. So this is not a goodbye. It's a see you later. And I look forward to seeing you next month at the Mental Wellness Chat. And we are going to talk about stress management. Stay on to do the survey, and blessings for a good evening.